than we had in the past for these field medical teams. We're going to get 190 individuals that are coming from HHS, from our federal partners, to come in and help to relieve some of the stress for some of our caregivers. And as Carmela was saying appropriately, not just the nurses, but also our doctors. I want to acknowledge, by the way, the California Medical Association. They had sent doctors, they had sent a team of folks to New York during the peak of the pandemic and the challenges they were experiencing in California, and will continue to keep those within a 72-hour prism of being made operational, which is a guideline for what it's worth that we have established to allow us to move if indeed we see some additional stresses outside of our surge plans and our capacity that we have built within our hospital system. We're doing this because we're seeing hospitalization rates grow. As Carmela just said, it's mixing within households. We've said that on many different occasions. You're hearing that at the local level. You're hearing that across this country as well. Governors in other states making the same point. So often is the case. You have members, your extended family of neighbors from outside your household. We take our guard down a little bit, and we're seeing, at least based upon the feedback we're getting from our county health experts, that is one dominant area of concern. Obviously, a consistent area of concern, but again, I cannot impress upon you more how impressed I have been of that task force delivering on that goal, which stretch goal was 80,000. 60 was a baseline, 80,000 on a daily basis. They've exceeded that, over 100,000 now averaged over a 7-day period, but positivity rate continues to climb. Let me give you this slide. As you've seen it often, this positivity rate shows you a cohort of positivity rates that we put together over a 14-day period. This represents an increase of roughly 39% over a 2-week period in total positivity rates. So that's of concern. I've made this point before. I'll make it today. Every decimal point is a point of concern, and I cannot emphasize more a point of consideration for all of us that we have the capacity to move that number down by our individual behavior, by wearing masks, by practicing the hand washing and physical distancing and social distancing that's required of all of us at this moment. At peril, that 7% can spike and quickly into the double digits, and you've seen in other states even into the 20+% range. And so we're monitoring this very closely, and all of us should monitor our own behavior accordingly, even more closely, in order to mitigate the spread and the transmission of this disease. Speaking of spread and transmission, we have been transparent in terms of providing a list to you on a consistent basis of counties that we're monitoring on a list. Some refer to it as a watch list. More formally, we refer to it as a monitoring list. These are counties that put out attestations that attested to containment plans and procurement plans in terms of their own strategies to procure assets and resources, human resources, physical assets, to meet the needs of their communities, their particular counties, and their particular and unique circumstances. Today, we're adding 3 new counties to the monitoring list for a total of 26. A week or so ago, we had 19 counties on the list, 23 counties when I was with you on Saturday, 26 now with Napa, San Benito, and Yolo County now on the list. Remember, the monitoring list then requires some modifications to the stay-at-home orders, the modifications in sectors that require a lot of indoor activities to be brought outdoors. And I want to just acknowledge that a number of these counties didn't come kicking and screaming. In fact, reached out to us in anticipation they were likely to enter onto the list, and we are very proactively working with them, have been, and engaging them on making sure that we're all working together on the technical assistance and helping them support and prepare for the modifications in their counties. Accordingly, just to reinforce that, you'll see that we've had 18 counties already move forward their own locally issued orders. 4 have just submitted to the state orders, and 4 are awaiting action. 3 of them we're just announcing today, Colusa, that I anticipate will move very quickly. And so I just want to thank again these counties The partnership is really demonstrable. I know there was some flare-up and some consternation, a few months ago, and people had their own ideas about pacing and their own considerations. But the overwhelming majority now of counties are just conducting themselves as we would all hope. And I'm very, very pleased and proud of that, and very thankful. I just would be remiss if I did not acknowledge their local health officers, their city administrators, their county board of supervisors for their patience and their assertiveness as we move into this new phase and try to mitigate and tame the spread and transmission of this disease. As always, the best way to do that is wear that mask. As I said, physically distance where you must, where you can, socially distance, as always, from cohorts that are outside your household and strangers, and do, as Carmela said, the basics. Wash your hands, simple hand hygiene, and making sure that all of us are taking very, very seriously this moment. I cannot impress upon people, before I open up to questions, the potency of your individual decision-making. And I just want to underscore the potency of that, because we had 111 lives lost in the last reporting period, 111 lives lost. Again, sort of breaking a little of the mythology why we're seeing mortality rates that have declined. That masks, forgive the pun, the reality still of hundreds of people across this country dying on a daily basis of this disease. 111 here, just in the state of California alone. Lives lost, families destroyed, torn asunder. Loved ones that will never return. And so I hope all of us are sober about that and cognizant of the moment we're in and the vulnerability that everybody has at this moment. This moment will pass. We will get through this. We will become more resilient as a state, as a nation. I would argue globally as a world. We will. There's no question in my mind about that. The question is when, and that determines basis on the determination of how we conduct ourselves, how we behave. It goes to the question of how do we safely reopen our schools and when do we reopen them. In many respects, that's determined on our behavior, on what we do over the course of the next few weeks to mitigate growth and spread and transmission of this disease. Data makes those determinations. Data and science make those decisions. And fundamentally, that's what's guided us into that March 19th stay at home. To making the first subsets of modifications on May 8th as it relates to the modifications to the stay-at-home, and now working with these 26 counties to monitor and put that dimmer switch, as we refer to it, back in play to address and mitigate some of the sectoral guidelines that we put out and address the concerns around these spreads, mitigate the growth of the spread of this disease in counties and communities large and small. So forgive the long-windedness of today's presentation, but I wanted to give you an assurance that the last 4 months have been meaningful and intentional, and we have done an enormous amount to prepare and presenting you today. I hope you feel a sense of that preparedness to meet your needs, to meet your neighbors' needs, your community's needs, the state needs, and to do so head on. But again, we need your compliance. We need your support on wearing these masks. And if you're a senior, if you have these pre-existing conditions, if you are vulnerable to this virus, and in that category, we cannot impress upon you more to take very, very seriously this moment and do what you can to stay home except for essential purposes and essential needs. So with that, of course, now happy to answer any questions.
Sophia Balog, SACB.
Hi, Governor. You mentioned that the state is sending masks to other states. Can you clarify how many masks you guys have sent and exactly what threshold in terms of, mask capacity that we have as a state that led you to the decision to send more to other states?
Well, hundreds that you saw on that slide, you'll see the threshold quite in numerical terms, quite in detailed terms of the detailed list capacity the state has, hundreds and hundreds of millions of masks. When we made the agreement for a large procurement, which many of you have written about, I hope you'll consider the fact that that procurement prevailed in 72 million N95 masks. Just one contract, wasn't the only contract, over 189 million of our procedure masks. We're able to do that in a very short period of time, a concentrated period, just over a 60-day or so period, plus or minus. We were able to procure that. I don't know another state in the country was able to procure at that scale. Part of the agreement in partnership with our federal partners, particularly FEMA, was a consideration of need to those most in need. We did that with ventilators. We're part of the human condition. We are one of many states. We feel very connected to the American spirit that must meet this moment and the needs of our brothers and sisters in other states. And so I mentioned a few weeks back the number of 17 million. That's more specific to your question. I had mentioned that on a number of occasions, including one state where we had sent, and I think everybody would understand why, and that's Arizona masks. We've also done it in Alaska, Oregon, and Washington, and we're looking to do more as necessary. But we must always, in the threshold in terms of the question, we must also, as a primer, as a foundational principle, meet the needs within the state. And that is precisely what we've been doing over the last number of weeks as these new supplies have come in. And you saw that in NTA, which is the California Manufacturing Trade Association, that also is helping sectorally reopen the economy safely, and how we're partnering with them on the distribution of masks. Our first priority, of course, our front line, men and women in the hospital system. By the way, hospital systems procuring, as I mentioned a moment ago, their own PPE in addition to what the state's doing. So we're trying to supplement that, find gaps, farm workers and the like, and seasonal farm workers coming in. So we feel at the moment we are meeting the needs. But as I said a moment ago, we're getting these out in real time. So the orders are coming in, and we can't get these masks out quickly enough. And so we're putting together a spreadsheet where we think we need to be. And all I can assure you is we're continuing to procure even more masks. We're not going to sit back statically and allow that stockpile to deplete. So we're back to where we were in March.
Renee Santos, CBS 13.
Hi, Governor. Thank you for taking my question. You know, we are seeing more cases. Cases are increasing, but many of those people are testing positive and some are asymptomatic. There are concerns about these so-called super spreaders. Can the recent increase in cases be attributed to these super spreaders? And should people who essentially aren't showing symptoms, should they be getting tested?
Well, we've tried to encourage testing, and particularly in our diverse communities. We've been able to put up a site, and this is my opportunity to remind you and allow you to avail yourself to accessing the site, covid19.ca.gov, covid19.ca.gov. You can type in your zip code, and we will provide information about the availability of testing sites that are proximate to where you live, and also the reimbursement or costs associated. A vast majority of these, there is no cost associated with getting a test. As I said, either on Friday or as late as Monday, I'll be putting out a different frame of engagement on the testing that will go more substantively and specifically to your question, because we are now looking to really target and modify our testing criteria in a much more strategic way. We actually put a little guidance out on Sunday. I don't know that you had a chance to take a look at that. I encourage you to take a look at it. It's on that same site. That gives you a sense, sort of a preview of where we're going with our new testing protocols in terms of really targeting most vulnerable members of our community, most diverse parts of the state, and still addressing some existing testing deserts that we have to address in the state, and obviously the supply concerns that I mentioned a moment ago. Look, as it relates to why we think the hospitalization rates are up, you saw that slide. Those are the four areas that our experts, the health officials that we're engaging, our own health officials, our hospital partners, those are the areas where they suggest most of the activity is occurring in terms of the cause and effect of why people are ending up in the hospitals. Those vectors or super spreaders, however you may want to define them, we've defined those 4 categories as areas of most concern. I will say, full disclosure, if you look more granularly, and I brought this up on many previous occasions, so I didn't feel the need to do it again today, you'll see regional considerations. Imperial, we've talked about a lot of people, dual citizenship, cross-border activity down in Imperial, that's also an issue. And so there are many other micro factors, but in the macro, those are the 4 areas where we think are the most contributory in terms of the increases that we're experiencing.
Baker, Bloomberg News.
Governor, I wanted to ask you 2 related things about San Quentin Prison. One, are you going to be transferring more prisoners out of there into other facilities, especially since we've had outbreaks in some other facilities now? And 2, are you going to go to the prison itself yourself and speak with the staff there or some of the family members of the prisoners inside?
Yeah, I've visited San Quentin on many, many occasions on a daily basis, including right after this press conference. We'll be reviewing additional releases. To answer your question is affirmative. We've been able to decompress it feels like it's a hospital now, but that prison from that number, which I've mentioned on Monday, mentioned previous week, 4,051 prisoners on March 1st. The goal is to get it down to 3,000. And it looks like as of today, this morning, we think we have a plan in the next few weeks to bring the population down to 3,076. So from 131% capacity where we were just a few months ago, and now getting it down below that 100% capacity threshold. We still want to do more than that so that we could provide more cohorting, more isolation of inmates. Of course, we have staff concerns as well. We're using the chapel and the gyms differently. We have now our FMS. Mentioned FMS as relates to alternative care sites. We actually moved one of our FMS sites to San Quentin proper. I visited Vacaville Prison yesterday, where we're doing the same there in a very proactive way, and had the privilege of being with the federal receiver, the judge, or rather not the federal receiver, but federal judge that has been doing a wonderful job trying to address the needs of our entire system. And so I am very, very grateful to his leadership. We were there with the acting warden for his leadership, Vacaville, and was there with many of the leaders within CDCR to get a first-hand sense of what's going on. But I've not been just visiting the prisons recently. I've been doing that on a consistent basis. It's been a cause, if you've been following me for decades, big cause of the why. When one answers why do you want to do certain things in life, criminal justice reform has been a big part of that. So this weighs very heavily on all of us and me. And as I said, there has not been a day in the last few weeks where we're not working individual by individual to try to address the needs at San Quentin and more broadly Chino and other parts of the system that we have a responsibility to address as well.
Jeremy White, Politico.
Hey, Governor, thanks for taking